Welcome back, everyone. Kratom. Some of you may know what that is. Others never heard of it. It's derived from an herb grown in Southeast Asia, and you can find it at stores across the area. But in September, the FDA sent out a warning telling consumers not to use it, concerned it would expose users to the risk of addiction, abuse, and dependence because the effects are the same as opioid on the brain receptors as morphine. Now, Western Mass News reporter Caroline Powers is digging deeper into what this product is and if it's a problem in our communities.
It's actually been around for quite a while. It's a natural plant from Southeast Asia. It's part of the coffee and the gardenia family.
Kayla Koch is a co-owner of Western Mass Hydroponics on Boston Road in Springfield. Kratom has been on her store shelves for about a year now.
Capsules are very popular right now. The concentrates, some people really don't want to venture into that yet. It is, again, a concentrate, so people that have been taking the powders and the capsules more.
Koch says different strains have different uses. Red is more of a sedative and helps with sleep, while white works as a stimulant, helping you stay awake. Koch tells Western Mass News most users put it in their coffee or tea. Aquarius Hydroponics Incorporated in Agawam has been selling the capsules, powder, and concentrates for 7 months and have noticed it becoming more popular, leading them to expand their inventory.
There's a variety of reasons why people would take it. At low doses, it can act as a stimulant. At higher doses, it can act kind of as a sedative. So people take it just for those reasons alone. But also there's people that take it because it's said to hit the same receptors that opioids hit. So people trying to kick opioids can get relief from those withdrawal symptoms by taking Kratom. So there are people that take it for that use.
But the U.S. Food and Drug Administration has a warning for consumers. According to the National Institute on Drug Abuse, in 2017, the FDA identified at least 44 deaths related to Kratom, with at least one case being a result of using only Kratom. The FDA adds many of the Kratom-associated deaths appear to have resulted in consumers taking Kratom with other harmful substances, including illicit drugs, opioids, alcohol, and over-the-counter medications such as cough syrup. In April, the Centers for Disease Control and Prevention weighed in, reporting that Kratom had been determined to be a cause of death by medical examiners in 91 out of 27,000 deaths examined by the agency over an 18-month period ending in December 2017. Dr. Susan Carey is the medical director at Savita Health in West Springfield. She tells Western Mass News Kratom is something they are keeping a close eye on.
We've been reading about it. We've been talking about it. We've been teaching our staff about it. So probably 3 or 4 months ago, we did a survey through all of the Massachusetts offices anyway, to find out, just asking patients saying, we're not testing for it, but have you heard about it? Is it out there? Are you finding it? If you wanted it, would you know where to get it?
Reported health effects of using Kratom include nausea, itching, sweating, dry mouth, loss of appetite, seizures, and hallucinations.
With overdose, with excessive use, we can change the brain, and then it makes it very hard for it to go back. So I think that's kind of our biggest concern. One, that people don't take it seriously, and two, that it can do some damage that we don't actually know about yet.
As of September 2019, there are no FDA-approved uses for Kratom, as the agency continues to investigate the safety of using it. For Western Mass News, I'm Caroline Powers.
And Western Mass News did reach out to the companies of the various Kratom brands and products featured in our story, but we have not yet heard back. In a statement to Western Mass News, the American Kratom Association says they do strongly support appropriate regulations on Kratom products marketed to consumers here in the U.S.